of you. Myself, Dr. Vishwajeet Singh Rathore, practicing as a physician in Ujjain, Madhya Pradesh. So today we are talking about the latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to the non-communicable diseases, of which 27% are attributed to CVD, which affects 45% of people in the 40 to 69 year of age group. Among these, the raised blood pressure is among the most important risk factor for CVD. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has gone up to over 30 years to 38% in men and 32% in the women. Despite that, nearly half of the people with hypertension were unaware of the conditional. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get appropriate treatment. Medication was used to control blood pressure is used in fewer less than 1 in 5 men and 1 in 4 women with hypertension worldwide. The AHA and ACC has released a scientific statement in 2021 offering a new guidance for management of stage 1 hypertension among the patient with low ASCVD risk. Among low risk adults with stage 1 hypertension, management start with the non-pharmacological therapy. If the blood pressure remain uncontrolled at the 3 to 6 months, consider starting pharmacological therapy. The lowering systolic blood pressure target down to 110 to less than 130 mmHg range substantially reduced the CV adverse events in the STEP randomized trial, affirming the sprint finding for an older Chinese population. Among the 8,500 patients of ages between 60 to 80 in China, the intensive target claimed 26% of the composite CV risk findings from the new second major trial supporting a lower target could unite the guidelines, which even among the US professional societies range from the threshold of 130 to 150 mmHg. With regard to the prognostic value of ambulatory blood pressure monitoring and the nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommended that the diagnosis of hypertension should not only depend on the office BP measurement but also on the out of office measurement, such as ambulatory blood pressure monitoring or home blood pressure monitoring. 24-hour and the nighttime BP measurement were associated with the greater risk of mortality and the composite of CV outcome. Thus, they may be considered as the most relevant measure for estimating CV risk. For every 20 by 10 mmHg increment of blood pressure at night, the risk of mortality increased by 23% and the risk of cardiovascular event by 36%. Most of the patients with hypertension require lifelong medical therapy to achieve the optimal BP control. The 2018 European guideline usually recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guideline recommend, especially in the context of lower BP target, to start antihypertensive therapy with initial dual fixed dose combination of AC inhibitors or ARB to combine with CCB or the diuretics. Since early July 2000, products containing valsartan have been recalled worldwide. The reason is the detection of known carcinogen named NDMA, which can be found in candescent, irbesartan, losartan, olmesartan, and valsartan. NMD has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 10,000, 1 lakh per patient would have received NDMA contaminated valsartan from Beijing, Hawaii. This is the manufacturer site where the highest level of contaminants were found every day for 6 years in the highest dose. It can result in 22 additional liver cancer over the lifetime of this patient. The presence of NDMA in this drug could lead to 8 additional cancer cases in over 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by significant increase in the rate of emergency department visit by increasing the 60%. The next is the HYGIA study, represent the largest study that tested 9-time antihypertensive treatment. In this trial, chlorotherapy was associated with a significant reduction in endpoints, including death. The HYGIA chronotherapy trial tested whether nighttime therapies comparison to upon awakening hypertension therapy exerts a favorable CV risk reduction The largest study included a total of more than 19,000 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced this primary CV outcome. An ambulatory BP measurement was performed over 48 hours to collect data on how BP differ during sleep. The RR reduction for CV events was significantly improved for nighttime treatment when compared with the awakening treatment. So these are the latest updates on the hypertension from the last 4 to 5 years. Thank you.